Now, I want to talk about the NHS, the thing that people dare speak ill of because it's apparently free. Well, firstly, we need to stop calling it that because it isn't free. Let's get to grips with that fact. We're paying for it and through the nose. And actually, if we paid for it like private medical cover, it would probably cost us more per month. And did you know that the NHS has 675 staff earning over £150,000 a year? So whilst the rest of us face a tax hike to the tune of £12 billion to clear post-pandemic waiting lists, managers at the NHS, and it is mostly managers, are being paid a feastly sum. Now, Amanda Pritchard, who is the new chief executive of NHS England, earns up to £260,000. That's £60,000 more than the previous holder of the role. And the two highest paid managers at NHS Trust received up to £310,000 each last year, almost double the salary of the Prime Minister and at least 10 times the salary of the average nurse. Those who are earning these ludicrous, eye-watering sums are mostly managers. And what's more, they're spending our money on CAC. For example, during the pandemic, not content with rainbow-filled windows as far as the eye can see from almost every household in the UK, many NHS hospitals spent thousands painting rainbow crossings. Salisbury NHS Foundation Trust spent £11,000 on 4 of the darn things, and more than 20 trusts have spent over £46,000. Ridiculous. What are we paying these people for? Managing what exactly? I mean, from where I'm looking, the NHS is one of the most badly managed things I've ever seen. Sack the lot of them. I mean, they talk about a frontline staff shortage. Well, I'm not surprised. The caring, vocational nature of those doing the real jobs are being paid a pittance for the privilege, whilst a load of managers, almost 700 of them, are getting over 150k per year of taxpayers' cash with no accountability as to what they're actually doing with it. Collectively, that's about 100 million on these people. Think of the training this could subsidise and the incentives we could offer British people to fill the real staff shortage. We could fund the education of new nurses and doctors from this country instead of relying on cheap labour from abroad. And now we learn that not only are they not slimming down the bloated bureaucracy of the NHS, in order to clear the backlog, the government are apparently going to spend the extra £12 billion of taxpayers' money on paying NHS trusts more money if they clear the backlog faster. Oh, God. A return to payment by results. Health Secretary Sajid Javid said a payment system that incentivises strong performance and delivers value for the public. So, the long and short of it, a trust that exceeds its target gets more. A trust that doesn't gets less. Well, we saw how well that went the last time. When will they learn that monetary rewards to reach a target do not work in a healthcare setting, especially with the disjointed network of trusts competing against each other? It will obviously result in corners being cut and priority given to conditions with faster treatments. So guess what? We, the patients, will suffer, and there's always a way round the system. Everybody knows that's how it goes. I mean, this is completely the wrong approach. Centralise the NHS, for goodness sake. Cut the waste, fire the overpaid bureaucrats, pay to train new frontline staff from this country and give them a decent wage. Stop fleecing the taxpayer and coming up with these neolithic, harebrained schemes. NHS. It's a complete rip-off.